I haven't yet checked that.
I think
Yeah,
that
it
is
is.
something we have already covered in one of our webinars. That part, right, Dipankar? LU04, yeah.
Yeah, yeah,
Yeah, I'm
distortion
guessing
due
so.
to government.
But I've also, prepared LU04 only.
Huh. That is basically quite easy to understand. Basically,
Hmm.
not much content, but then that will help us. Like basically asking the whole document says whole this thing whole learning unit says about rent control, controlling rent.
So it's broadly about this price controls.
Huh.
Rent control is also a part of it. So
Yeah.
total में there are a couple of topics there na. So there's price ceiling, rent control, price floor, consumer surplus, producer surplus, impact of taxes, tariffs and quotas, and finally free goods. And then rent control is also discussed separately.
Hmm.
Uh, so okay, I'll start on that. Just a second. Also, Deep is just joining. I'll share my screen. I had prepared this.
Dipankar, what would we have done without you?
Yeah, exactly.
Entire
I
screen.
really wonder where does he get that energy from? Managing work, reading, sharing with us.
Exactly. Is it something to do with the temperature and the latitude?
Huh? uh, okay.
Ashoka is also joining.
Yeah. Well,
I'm seeing my photograph on Arshal's profile here. I don't know why.
sorry.
Yeah. हाँ अभी ठीक हो गया.
Huh.
Uh, okay, I think everyone's still joining. So maybe we'll wait for till 7:10 and then start.
Let me do one. Let me just join it from my computer. The screen in my mobile is very small.
So in the meantime, while we are waiting for people to join, did you see this thing from May has sent a question now for tomorrow?
Yeah, I shared in a group as well.
Pranay, no? Pranay.
Pranay, sorry, not Ame, Pranay,
Yeah.
yeah, yeah. You know, which talks about this policy proposal to liberalize medical education.
Huh.
So
I
it
was
says what?
reading. I
Huh?
was reading through two articles. I just share. Probably we can get some ideas from them.
Please do that now. Please do
Yeah.
that because I
Then
think it says that you will individually answer this question in the first 10 minutes of tomorrow's session.
so we'll have to give us some suggestions, right? How to do it.
Yes, yes.
You guys can also refer to this this post they made on medical education last week.
Who's done
Just
it?
Okay.
Pranay and this Raghu Sanjay Lal Jetli. So
Oh,
this is.
can you share the link on the chat box?
I'll just
I
share
think
that.
this will suffice. Probably they will be like since already worked on that. Best we look at that part.
And everyone who's listening, so before we end this call, na, we have to do Dipankar Baba ki, and everybody's supposed to say Jai.
RP.
Okay?
Yes, yes, we have to.
There are
Please
not
do
enough
that.
GIFs on Google Meet.
Uh,
Sorry, Sadeep. What did you say?
There are not enough GIFs on Google Meet to pay to the
I'm
Baba.
I'm still trying to understand who's Baba number one and who's Baba number two. I think Casey is definitely number two.
Uh, and we also we shouldn't forget Ashoka, huh? In this.
Ashoka also, I like how Chitra also is like when she answers the questions, she gets very intense when she answers the questions.
You may
Sorry,
consider me the.
where am I even in this equation? Like,
Ashoka, what are you talking about? When you start talking, you also are very passionate about it, yeah? Of course.
oh yeah, that. So yeah, I mean that's why I took this course, but I'm like nowhere at Dipankar Casey's level.
पता लेट मी टेल यू वन थिंग मेरे जैसे लोग ना वो कोर्स का तो कम सुनते हैं हमेशा मैं ये देख रही होती हूँ कौन कितनी बात कर रहा है
yeah, ये है. Okay, I'll share it separately on WhatsApp later on. So
Done.
Yeah, yeah.
basically, in it, what they're suggesting are basically there are some unreasonable restrictions in setting up medical colleges. Until 2019, India may the medical education was supervised by Medical Council of India. I think they also did a podcast on it, but I don't know.
Hmm.
That's a bit old. So basically, Medical Council of India is comprised of doctors only. So
Mm.
in the name of maintaining quality, what those doctors have been doing, they have been restricting the supply of starting the medical colleges. So basically, the supply is restricted. As a result, there are not enough medical colleges in India, and there are a number of things that some of them really crazy that they make these colleges do. Like you need to have a certain size of your auditorium, your
Mm.
classrooms have to be of a certain size, and this has to be a fixed ratio. So tomorrow, if a college thinks of expanding, they have to build extra for that. So which imposes a lot of cost. Also, every medical college in India needs to have a hospital as well. So which again raises the costs. Second thing is again these regulations that there are, these are divided into tiers. Like does your college have 50 students, 100, 200, or 250? And based on these, all the criterias that they discussed previously, these change. So a college which say has 50 students and now can maybe take 75 students, they don't have any incentive to grow unless they know that they can have at least 100 students. So which restricts that the size of Indian colleges. And this is kind of similar to how India has a similar issue with medium, small, and that micro enterprises, because what we do is for companies which are smaller than 100 or say 1,000 employees, labor laws or a number of different laws don't apply. But once you grow beyond say 1,000 employees, you'll have to provide say maybe you'll have to provide bathrooms, you have to provide your PF and all that. So a lot of companies, what they do, rather than grow from say 1,000 employees to 1,500, they either don't grow, or what they do is they'll open a second company. So you have, rather than having one big company, we have a number of smaller companies. That was the second point. And uh, yeah, broadly, this these two were the reasons. And then there is price cap. So in India, 50% of the seats in private colleges are capped at. I mean, there's a price cap. So when there is already so much shortage, plus you introduce price caps, so which is one of the reasons why there is a lot of corruption in setting up these. I mean, in admissions to these medical colleges, especially the private ones, because you're not allowing them to grow. You're not allowing them to charge the fees that they want to do. So in the end, the only people who end up opening medical colleges are those who are politicians, because then they can bully around the regulators. But if say a honest person or a honest group of people want to open the college, they'll be harassed, and as a result, they never end up opening the colleges. So and then there were a couple of recommendations as well. So, for example, this Devi Shetty recommends an undergraduate medical education in private hospitals. So, okay, I don't know, I didn't read this. One thing that government has introduced for shortage is that, and this was very controversial, what they said was Ayush doctors, basically doctors who have been educated in Ayurveda or Unani or homeopathy, basically
Yeah.
they can do a bridging course for 2 years and then they'll be recognized as normal doctors. So this was intended to bridge that shortage of doctors, but then other doctors were like, I mean, we spend 8 years studying, and then you're giving people 2 years license based on 2 years. So this is broadly the issues in medical education. Huh.
But
I would just like to add in here
Hmm.
something, maybe some big critical observation.
Hmm.
This basically I have realized that the Takshashila basically focuses on a for market sort of policy thing. They're more into, they were leaning towards the capitalist market structure now.
Hmm.
But that I believe as policy analyst, we need to have a rounded thing. That's my perception. What I read in one of these articles I will share it in Times of India.
Hmm.
One of the reasons is that one of the big changes that was done regarding medical colleges was that earlier medical colleges or anything, even though all education institutes need to be organized as a non-profit organization, as societies or trust, right? When this change was made, I think in 2016, it changed that people can organizations can be for profit, and they can organize, they can start medical colleges. So one of these, I'll just read out one of the paragraphs here. Allowing the entry of for-profit companies also led to those running societies or trusts asking why their own colleges could not be converted into for-profit entities. In January 2017, the government acquiesced and notified that any medical college set up by an autonomous body, society or trust could be converted into a company, thus ending all pretense of medical education being a not-profit venture. And also, I really agree. I agree that one of the reasons was a lot of politicians used to open medical colleges, and they used to charge a lot of capitation fees, leading to the high increase of the fees and all. Um, just read about Dr. Sundaraman, former dean of the TIS School of Health System Studies, pointed out that overproduction of doctors will suit corporates, but not for the country. Doctors will accumulate in urban areas, leading to unhealthy competition, and they will try to milk patients, as is already happening in Mumbai. We need a policy that will get people to underserved districts of North and Northeast in India. So I'll share this article. I think with this we can have a more holistic kind of view.
Sure. Thank you so much, Arshil.
So Arshil, do you want to talk about that a little more? So I mean, a fair disclosure, I am a tad bit libertarian in that nature. So I am generally skeptic of government-led solutions. I am in general in favor of private education. So are you saying ki, the problem is privatization of education, or that doctors will not serve in underserved areas?
See, I believe that these are two of the areas, medical, healthcare, and education, in which people like it is how do I say it is like inelastic. People would spend money. The biggest fear of our lives is fear of death, right? That's the
Right.
biggest fear that we have. If you see, people spend most amount of money in healthcare and education. And
Right.
education, when it is given by the government, when the government spends money on it, I think that will help as a great level of things. The way right now the education structure is formed in India, where a lot of private organizations are involved, giving out high this thing, better quality in education. The government has they stayed back. Most of the good education this thing are provided by the this thing. There's something some nexus has formed whereby I'm not able to exactly express my words correctly here. So say education is supposed to be a big leveler. Same again with in case of healthcare as well. Healthcare, we have seen the poor people have to sell off their with a huge rise of healthcare and all, right? The private healthcare system has been like almost
I mean, the healthcare prices have.
squeezing the poor. Like, I've seen people a lot of selling their land and getting indebted to just to get the people back in good health. So
No,
we
I,
have
I
seen
completely get where you're coming from, Arshil. I'm able to like internalize what you're saying.
these are the social security system that the government needs to produce. What I understand, I'm trying to understand what are the services as a government when they collect taxes and all. What are the services that the government should spend on? I agree on the defense part. I agree on the home security part. I agree on the public infrastructure part. But I also believe that healthcare and education should also be something that the government should totally focus on. This is something that the some of the very developed countries in Western Europe follow, and that's how the level of this thing.
Arshal,
Like I said.
can I ask just
Just,
one
just,
question?
just give me
How are
one.
we going to how are we going to convince a politician
Huh.
that this needs to change? I mean,
Okay, I have an
right?
answer to that.
Yeah.
Yeah, I think Pranay's question was largely focused on the narrative, right? Not
What
on.
story will you tell? Yeah.
So I think in the current scenario that we're living through, the narrative is quite obvious.
That we want
So you
students
just
here.
exactly you want students to study in India, so you need more medical seats in India, and so you avoid all this unnecessary geopoliticking and this hostaging of our students and their stress and all of that. The Prime Minister himself has said that more students need to study in India. So what's the surest way to expand the market, create more seats, is seems to be to liberalize the entire thing, right? Like
Yeah.
look at what happened in telecommunications, look at what happened in what have you, any other field. So the quickest way to kind of do it is probably to liberalize.
And probably he'll get more votes also.
Yeah, likely, but again, so the possible unintended consequence or whatever of that would be what Ashil was saying, is that this huge mushrooming of, we've seen that with engineering colleges, right? At least I've seen that in Tamil Nadu, in Andhra Pradesh, where there's this sudden rise of engineering colleges in every little shanty little town, and there is no quality, right? So it's just, you have infrastructure, you have like tables and chairs in place, and you have some graduate calling himself a teacher and coming and teaching you, giving you medical education. But what would be the quality of these doctors that get produced? And what will be the fees that is going to be charged by these colleges? So all of that are questions. I fall somewhere in between Dipankar and Arshil on this. Like, I do think that I do agree with Arshil when he says that education and health are public goods. So, government needs to provide those, and I think government needs to be the primary provider of those. But having said that, the government alone cannot do it. So it is perfectly okay to bring in private players to do that also, as long as we keep a check on, say, things like quality, making sure that these guys are giving the right quality education, because these are doctors we're talking about. These are people who need to go out and save lives. So, I mean, that's where I fall on that spectrum.
Okay, maybe I should clarify my stance. So I am for market solutions, but I'm not for only market solutions. So even if we look at the current scenario, so Arshil, we're talking about, so I understand your fear is that if we have private education, private medical education, the prices will be high, and then those doctors will extract the same, harass or extract that amount from the poor patients. But the problem is when we don't have enough seats. So before that, you use the sentence the government should do this, should have private, medical education. My only contention there is when we say government should do this, we should also ask, can government do this? And there the question, at least in my mind, remains that to the scale that India needs it, government is not able to do it. Maybe in future, when we are rich, then we
I
can.
agree on that part. I agree on that part. Yeah.
And secondly, if say we have a private medical college for profit and it's charging a certain fee, even now when we have only government solutions, government for not profit non-profit colleges, what ends up happening is you don't have enough seats. Your students, some students desperately want to become a doctor. What they end up doing is they end up spending that money in Ukraine, Russia, I don't know, Bangla. I've heard of there are a lot of newspaper ads here, and I see we have students going to Uzbekistan, to Bangladesh to study. And I'm pretty sure India can offer better education than Bangladesh and Uzbekistan. And there also these kids are spending huge amount of money. So if that money is earned by a private corporation, if the outcome is same, why should we say that it's a bad thing? Government should definitely be there. And then regarding the underserved areas, we could have government, once we have say a sufficient private sector, we can then say all medical seats in government colleges will be say free education. I'm not against that. If there's a sizable private market, we could have say 100% of public government medical seats to be free, with the condition you will have to serve in the this underserved areas.
But I also think there could be other ways to incentivize serving in underserved areas.
I think Tamil Nadu has this. I was reading this op-ed. So they said in Tamil Nadu, for you to get a
2 years of compulsory rural service.
So once you do
that, it's the same in Assam as well. It's the same. If you have to get a seat in government,
no, but the problem then becomes that people just wait for those 2 years to be up and just run off to some foreign country.
Exactly. They will look at ways to get transfer somewhere else by paying money and all. Corrupt practices to get it.
Yeah. So, okay, so that's a lot to think about. I have not thought about it that much.
So I think the Tinbergen principle is applicable here. One policy, one result.
Yeah.
You target, you cannot kill corruption with this. So, just look at what we can do.
The other part of it also probably is that I'm not sure if this will work in a market, but if there is a market in the rural areas for healthcare, there would be people who want to tap that also, right? Not necessarily just the government, but there
Great.
could be private players who want to tap into that market.
Yeah.
And today we are in a connected world where we're thinking about the universal health ID and getting everything digital. And I was actually talking to a doctor a few days back who was saying that, like, the primary health centers, right?
Hmm.
The work that primary health centers do can today be done by machines, because it's mostly like they just run like fever clinics or a very bare minimum kind of thing. And the moment there is a slight, need for higher level care, they get referred to a district hospital or to a secondary center. So this could, like, bringing in digital and all could, like, radically change the way we look at healthcare.
I was reading another article why students are preferring Ukraine as a medical option to study medicine. One of the reasons is most of the education that imparted in Ukraine is English. And another option is that it's very easy access to the European market, the Eastern or Western European market. So, and it is the medical, this MBBS degree given by Ukraine-based universities are accepted in those university places in Europe, whereby they don't necessarily have to appear for any other qualifying exam that like that one need to have appear again in India to start practicing. So that's probably one of the incentives to get where people go to study Ukraine. There's a more easy and lucrative market available there.
Right.
So the other question also is something, I'm just throwing whatever interesting things I can think of. They not might necessarily relevant to Pranay's question, but there is a growing, kind of uncertainty or kind of thing among young doctors about their future, because a lot of doctors today don't find the meaty jobs that they thought they would. Like, a lot of MBBS graduates are just duty doctors in some second grade private
Exactly.
hospital making like 10-12K a month. Like, that's
Yes,
less than what a
after paying
software
15,
engineer would make.
exactly.
That's the market telling you something, right? I mean,
Exactly. So
Exactly.
then my question comes back to, should you even increase the number of seats? Because then you're
no,
essentially going to
so
have like MBBS graduates becoming like Swiggy boys later down the line. I don't
So,
know.
no, I know where I'm coming from is, if there's an acute shortage of doctors in India, then what the government can do is open up opportunities to get trained as doctors. But if you do not find jobs, I mean, it's not that every software engineer who comes out or every engineer who comes out earns in whatever X amount of money, or not every engineer ends up in an engineering job, right? So that is the market taking care of it. What government can do is ensure that there are enough opportunities for students to pursue their interest in medicine. Post that, if they do not get a job or don't get meaty jobs like you put it, what can the government do? I mean, it is doing enough to provide public health services in a way that it's not, there's no acute.
I have a
So
point there.
I understand. Yeah, sorry, Deepak, I'll just make
Yeah.
it quickly. The thing is, I am talking about two different things, right? It's not necessarily to do with medical education. I'm getting into the job market and the employment side of things and that side of the headache here. But the thing here essentially is not that there is no demand for doctors. Is that doctors are in wrong places. Like in Tamil Nadu, every doctor wants to get a job in Chennai. So that's not going to happen, right? Then they're only going to be satisfied with 10,000 per month. They might like make the same 10,000 per month, say, in Krishnagiri and lead a very luxurious life, but they don't want to. So there is that gap. So I don't know how the government can come in here, but it's there. Yeah,
I
sorry,
I
Deepak, go
have
ahead.
a point there. I mean, I don't know. And this is just something that I'm thinking on these lines. It could or could not be relevant to it. So one thing that I'm thinking: why would a doctor who has spent say 8 or 10 years studying and then settle for a 10 to 15,000 rupee job? One thing could be that they don't have an option of a private practice. In the sense, I know this from my local experience in Kashmir. So what happens here? So usually because say this medical profession, we have a lot of expectations from it in terms of safety and all. So a lot of times there are a lot of regulations. So say a doctor wants to set up his private clinic, but then the regulations are so much, your this compliance costs are so high that they're like, I'm better off not risking my money, not risking my name. I'll just go in a any government hospital and just work there. That could be one reason. That are how what all regulations are there around private practice. That could be one reason why people are not choosing. I mean, they're settling for such low amounts.
I'll just share an example of Assam that's happening here right now. Basically, the government has been opening up this thing, government medical colleges all across Assam since last 7 years. Almost every district is having one. The problem is that they are offering us the medical colleges with about
Ashwin,
200
your
to
voice is
300 seats.
echoing.
Is it? Why so?
Jacob, can you hear me? I think it's
Sorry, 1 second.
yeah. Arshil, carry on, please.
Okay. So one of my doctor friends, he said that the biggest problem that these students will face is that they will not get a place to practice. They have been learning, but there is no medical hospitals where they can learn directly. Like they can just, there are no patients. There are no patients that can practice. And the doctors that will come out from these colleges will be much less
Experience.
skilled. So there's a problem that we are facing in here, Assam. So we don't have this thing, private colleges here, but then the government ones are actually lagging behind in the whole thing. I've seen this thing, the latest the last amendment regarding opening of private medical colleges. I've seen that they have reduced the number of suppose anyone who wants to open a medical college need to have a hospital as well as in place, and the minimum number of seats that beds they need to have is 300 seats. So these are few things that probably are helping out to come up with these private colleges. The guidelines have been eased down to get more people to invest, but the problem is that most of the politicians are getting into this lucrative market, and that's the reason the fees are very high.
Yeah, so that is actually my cue for it. Ki if I see politicians and people who can strong arm the regulator getting into it, then I'm like, something is wrong with the regulations that normal people are not able to enter it. So, for example, in you gave the example of Assam, and then like there are colleges but not enough hospitals for students to practice. This, to my mind, brought the question: okay, how easy is it to set up a college? To set up a hospital in Assam? If it is very difficult to set up an hospital, obviously there won't be enough hospitals there. And then you can have as many doctors. I mean, you could say that you have a doctor shortage and start opening up colleges right and left, but then you won't have any hospitals. Then the question would be, okay, we need more hospitals. So my broadly to every question, I am coming back to the point in my mind that okay, how is government regulating the supply of doctors or the supply of hospitals, and is that causing an issue?
Probably we will not get a solution. But then
Jacob, you were saying something.
Jacob.
I just wanted to ask
go
a
on.
very simple question. Okay, we're talking about education in isolation. We're talking about jobs in isolation. We're talking about colleges in isolation. But aren't all of them like dependent on each other? As in,
Yeah,
कॉलेज होंगे तभी एजुकेशन होगा,
that's what.
एजुकेशन होगा तभी जॉब्स होंगे, एंड जॉब्स के लिए यू नीड हॉस्पिटल्स, where people can, I mean, the doctors can practice.
Exactly. So that was my point as well, that we need reforms or these I mean, we need to look at regulations throughout this entire chain, from colleges to hospitals
Through
to
the
private
entire
practice.
ecosystem, I mean,
Yeah. Yeah, Jacob.
Yeah, fair point. So, I mean, I was thinking because, India exports a lot of nurses abroad. Like, you have Indian nurses working across, the Middle East and UK, Europe, everywhere. Now, I know this because my mom is a nurse and I have a lot of relatives who are nurses. And what they tell me is that let's say in India, it is you will get a job regardless of, whatever institutions are here, but it pays you very less, right? I mean, it pays you maybe 20,000, 25,000 rupees, but when you go abroad, that amount becomes 2 lakhs, 3 lakhs per month. Like that's the amount you get abroad. Now, there what happens, let's say in UK, for example, if you start working at the NHS is publicly funded through taxes. So in some way, you have a system where you are taking taxes from people and investing a lot in building a public healthcare system, which is not just offering you healthcare, it's also offering you jobs, like very highly paid jobs. Thereby, it is in some sense the government is a monopoly there in the healthcare sector. So my counterpoint, my this thing is, if you want to liberalize medical education, either you build like a very good public healthcare infrastructure, which is heavily taxed. But then the question is, how do you tax people at that level? Is also another question.
So are you, Jacob, are you telling us something extra additional tax for medical care?
So I mean, technically, how much do we spend on tax? I mean, on healthcare through taxes. I mean, I don't know the numbers, but I'm assuming it is very low, is what I think. Because because again, when you spend on healthcare, you're spending on something less, right? I mean, yeah. So Ayush is allocated 2,970 crores.
2%.
2.1% of your GDP.
We are 1.35%.
Yeah, so in the UK, how I understand it works is you have something called as the national insurance. So if you do a job, you need to have an NI, and every month from your income, you're deducted some amount which goes to your NI, and the NI funds the NHS, and it runs in that cycle. But the UK system is a very different system, but that public healthcare system works in a particular manner. By giving you very high paid jobs and at the same time giving you very low cost healthcare. So India is trying to do that with Ayush, is what I understand.
Ayush is the insurance, na? Sorry, Ayush is
that insurance scheme where you're automatically enrolled if you fall in that SCCC list or whatever.
Okay.
And then you can avail so and so many things, but it's still rolling it out. It's not completely.
This thing, unintended consequence of focusing much more on the insurance part is that it's driving up healthcare costs. I found out that whenever anybody who has a healthcare card, insurance card, the hospital charges more than more, because they know the patient will not be paying, but it will be paid by the government itself. The healthcare costs have gone up because of this insurance thing. And government actually has taken a backseat, promoting more about the insurance thing, and instead of investing in actual physical infrastructure, they are asking people to invest in these things, insurance companies.
Dipankar, on your regulator idea which you were speaking about, government as a regulator, I think you were saying about that, right? If I'm not wrong.
Yeah, I think we should take a look at what all regulations are causing this issue.
No, so what I was thinking is in housing, for example, there is this idea where government becomes a regulator or a facilitator. Okay, so you kind of create policies where you invite private participation to build houses, for example, public housing, for example, and you give them some kind of subsidies or leeways or those kind of things so that they can use it somewhere else. Okay, so technically, that's what I understand by this private sector partnership in any kind of public venture, is that you give them you tell them to do this, you do X, we will give you Y, is technically that. So if you want to liberalize medical education on that lines, you tell them to build colleges, tell them to do this, but you have to give them some Y or some X in return. What would be that is something which I've been thinking about this afternoon.
No,
If anybody has any idea.
when I thought about privatization or liberalization, in principle, I am very uncomfortable with the idea of this public-private partnerships, because it essentially means both of them are getting in together. And my immediate thought there is, okay, taxpayer is also paying, and the private partner is there with an expectation of profit. So how do we balance it? How do we ensure that cronies are not getting supported there? What I meant by liberalization or the regulations was that we need to see. So for example, driving down the medical cost. I'll give you an example. So when so we have, my family is in dental trade only.
Deepanka, there's an echo here. It's very properly.
Jacob.
I'll mute. I'm sorry. Sorry.
So in dental trade, basically, when you make a denture, when someone has to make a denture, there are two steps in it. Your doctor takes an impression of your teeth and your overall face, and then he creates a mold on which the denture is eventually made. So now doctors can do this in Kashmir. Sorry. Okay, so in and this is what I have seen in Kashmir. So a lot of I won't call them unskilled, but unlicensed people come in from, usually from Bengal and Bihar, and they do this job. Right, so the doctor will take a slight impression and he'll give it to these guys. They'll make the entire denture and give it back to the doctor. So in this way, you are reducing the cost, because a doctor's time is much more valuable that he create this denture, and this does not make it. There's no medical hazard directly into this, but then legally this is not allowed. So a lot of times these shops get raided, these guys get raided, and then for a few weeks this trade would stop. So when we are crafting regulations, we have all, because in medical scene, what we a lot of times do, which happened with COVID vaccines as well, we are too conservative. We think about, okay, no, maybe we have to think about safety. But in doing that, a lot of times we suppress the market so much, and maybe I should not say market, but we suppress the outcomes so much. We look at the bad outcomes so intently that we forget what good can come out of it. So, there was this talk that we had the vaccines ready in by May or June of 2020, but still regulators around the world took time because they were not sure, even though it did not make a great change. Similarly, if these guys are creating dentures, you could reduce the dental costs, but government will not let that happen. And they have good, points on their end, but then this is a debate that needs to be had. So if you have doctors,
Can't hear you, Deepanka.
Sorry.
That's interesting, because even with the vaccines, what happened, because they tried to buy it off at they tried to reduce the price, keep it free, etc. There's a very interesting article in the Ken recently where how America did its vaccine policy, where the state became the first purchaser of the vaccine.
Right.
So, basically, if you break it down, a vaccine is a positive externality, right? Which you should finance or procure. That is the simple logic of it. So what America did was, the state became the first buyer. It brought out all the vaccines and then gave it out for free. And that was offset somewhere else in its budget in that sense. So by then what happened is it balanced the market's aspiration of making profits on whatever it made, and also giving supplies, vaccine supply for free. But here in our case, you don't see governments becoming that procuring mindset most of the time.
But one thing, Jacob, in India's case as well, didn't the Indian government finance? They gave advance orders to these manufacturers, and in case of that Covaxin, they shared data as well. So we also did something similar here, but then the complaint that I had, that the regulators were too harsh on them. That was in America's case as well. They had mRNA vaccines. I think sometime in May or June they had it, but still they waited for more data because they were not sure how a vaccine could be made so quickly. So that's what I'm saying. Ki when we stop doctors, or in medical field in general, we move so slowly, or our first thought is let's not allow it, and only when we know that this is definitely going to be good, only then we allow it. So a lot of times that is the reason why there's so much lag in there. I mean, the participants, which would be the doctors and nurses, they don't get as many opportunities. The college, the people who own or operate the colleges, they don't find as many opportunities. I mean, that could be one reason. I don't know how to resolve that. You definitely don't want anyone to make a drug and then supply it. But I'm just saying that could be one factor.
Yeah, right now I am basically being part of the conversation, so I wouldn't know. But when we 2 points to Dipankar, when you were saying about the clinical trials, I think Pfizer was approved after the third results of the third clinical trial was shared and peer reviewed, but that did not really happen with Covaxin. One was that, and I don't think there were advance orders from India. So I don't know the context of the conversation, but I just wanted to say
Hmm.
those two pieces. I don't think that the Indian government really placed any kind of advance orders with either Covaxin or Covishield till pretty late.
Okay.
And the clinical trial data for Covaxin came in actually
But Casey,
July of 2021.
wasn't this Covaxin developed by data provided by ICMR?
What do you mean data
I
by
mean,
ICMR?
I have not read a lot on this, but as far as I mean, somewhere I had read that ICMR had supplied some crucial data regarding this virus, and that's why even recently I think they made some 300-400 crores out of
So the
royalty for Covaxin.
Yeah, kind of, but it was not crucial data. But the mode of the vaccine was different because this was a a dead virus
Hmm.
that was basically used to build the vaccine,
Hmm.
which is not the case. It's called the mRNA vaccine, or
The
but
mRNA would be the other one. This
no,
is
this is basically it's got a name where you actually use the dead virus
hmm,
instead
hmm,
of basically using a similarity between the actual virus and something else.
right.
So that was the process for almost all vaccines at that point in
Hmm.
time. So yeah, but the point is that, not going into the details of how the vaccine was created, but the clinical trial, the phase three data did not actually surface till August of 2021,
Right.
but the first vaccine was delivered
Way before that.
to consumers or to patients in January of 2021.
Hmm.
So there's a difference in the way that we basically went ahead and approved it.
Hmm.
That did not happen with Pfizer, is what I'm saying. Pfizer or the other, what was the Moderna vaccine that was basically outlined. So
Right.
both of them, the initial vaccines that were available in the US, had to provide clinical trial phase three results before they were approved.
Right.
Is what the point was. Well, I sorry for interjecting like
No, no,
that
that's
because
perfectly fine. Yeah.
I just joined, so I don't have the full context of the
So
conversation.
basically,
Yeah,
we were
Dipankar,
talking
I
about
just made
this.
a comment
Yeah.
in the chat there.
Hmm.
I think to your point on the PPP model,
Hmm.
I personally feel like if since we don't have our primary healthcare and rural well infra
Hmm.
ready and also well serving to the such a big population,
Hmm.
why can't we start with the PPP model? Because I'll tell you one reference. Recently, when we had corporate funding came from our US office for addressing the COVID,
Hmm.
we couldn't spend like the amount that we got was 20 crore.
Hmm.
We couldn't spend that assisting with the government, and then lot of time PHCs do not even have an appetite. Even if I go to them with a 1 or 2 crore offer,
Hmm.
PHCs were not ready to accept because they said that we don't know what to do. We are not allowed to increase that infra.
Hmm.
That kind of infra, if you want to increase, then you should go to the rural hospital, and there are very few.
Hmm.
Amount that we had, then we had to go to the district hospital, which is anyway rich.
Right.
So the problem is district hospital, which is rich, is where you can build the infra. Your
Hmm.
rural hospital and PHCs are not allowed.
Hmm.
So if we create a system where this private funding that we have in a CSR way or any way,
Hmm.
if it is coming and if we can strengthen these PHCs and rural hospital, can that become an avenue for having that
Improvement.
staff?
Huh. So.
That means giving those jobs, maybe pay would be
Hmm.
increasing later on once the infra is developed totally. But Wouldn't that be a good start to address this
That
issue?
would be a great start, but that was my point as well, na, ki there are so many regulations around it that if someone wants to do some good, maybe our
Hmm.
regulations are stopping it. Maybe the market is not the problem. Maybe the people being greedy or corrupt or inefficient is not the problem.
Yeah, the corruption
Maybe
is a big problem
it is there.
because,
It is there.
yeah,
I'm not denying that. I was just wondering. Again, I'm not saying that is a solution. I was just wondering that maybe we should also give a look at our regulations. Maybe they are stopping it somewhere. So, for example, like you said, you are willing to spend the money, but then
hmm,
there were certain regulations which were preventing them from accepting the money or maybe expanding beyond a point. So
correct,
maybe
correct.
that should be looked at. So say for example, there is I'm not well versed in this medical regulations, but I'm guessing if a primary health center, say there is a rich benevolent who is willing to spend money, and
Mhm.
why can't it have specialized treatment? But I'm sure that it won't be allowed because
No.
you'll be like
Yeah,
primary health
because
centers only for this. Hmm.
by design, PHCs are meant for only the first aid treatment. Any secondary or anything that you have to move them to the rural hospital or district hospital.
Right, right.
Surgery is not even allowed in that.
Exactly. So what if I spend the money I'm willing? So for some reason I love my mohalla or whatever
Exactly.
PHC, and a great hospital can also provide these basic services. But
Yeah.
then that's what I'm thinking. Ki,
And that was our intent that
huh.
we picked up one of our PHC nearby to our factory and we told them that we want to develop this to, the good infra so that, villagers do not have to go
Hmm.
to the city area. But, it's, I don't know whether it's, yeah, it must be regulation, but by design,
Hmm.
uh, they said they cannot do it. So
Yeah.
they have to also relook at it. Is it a regulation or is it the, design of the system?
Yeah.
So one of that needs to be addressed.
So Amit, the point that you're trying to make is it what is it? Is it basically private sector or private funders providing modernization fund for PHC, or are you
Mhm.
also saying that uh, the space where the PHCs, the primary healthcare center now called health and wellness centers, um are they basically opened up for the private sector to operate also?
So there are no, I mean, we tried to, during that exercise, we did not find adoption of PHCs. We cannot adopt as a private partner. What we can
Yeah,
do
you
is
cannot. Right.
we can donate the infra
Yeah.
and they should run with the staff and operations. That's the commitment that government should give. But then government has a problem that they get an allocation of so much of staff. So if I
Right.
put let's say in a PHC there is no dental related treatment infra, even if you
Correct.
put like 50 lakhs to develop those dental treatment chair and all that,
Yeah.
but there is no dentist available. So what do you do? So what's going to
Correct.
happen is eventually that infra will die there itself.
Yes.
And it is the
Yes.
case. Like we
Okay.
donated so many oxygen, oxygen related those equipments,
Right.
and they were just lying. And they showed us like whole room was full of that, but
Full of
they don't have
ventilators,
a
but
trained
not being
person to
used.
use it.
Yeah, because a major challenge that happened was also the fact that there wasn't capacity to utilize the ventilators because there were no trained staffs to use the ventilators
Exactly, and then
or the
our
semi ventilators.
yeah, so the trained staff, and that's the article right now. Those who want to get trained and become a good doctor, they are going outside the country, and they are getting those high pay jobs, and that's why. And then on the other side, we don't have the good staff to utilize the capacity or the infra that we already have, in some level. And in the end, the citizens are also getting impacted.
So, Amit, one question: what is the incentive of a private company to donate for PHC?
Yes,
As in,
so
what are you getting out of it?
that's a good question. See, in this case, if I see myself as a corporate, and if we, have our factory in the, area where we do have a community, so you always work on the community that is surrounding you. So the motivation, so what happens is community always looks at you as a corporate that you are giving us job, but what else you can do for us? Okay, and then through CSR you can always do so many things, like we do work on schools, we do work on small clinics there. But this time, since we had such a big funding because of COVID and all those reasons, so we thought, can we adopt the nearby hospital and make it such a good infra and make it to the level of district hospital, so that those villagers, which is like 30 kilometers from Pune, they don't have to come to Pune. They will get treatment right there. But we couldn't do that. So we had to, segregate that money and push it to like 20 odd clinics, and that's how the project was done. But we couldn't strengthen one. Yeah, so the motivation for us to community service.
It was more philanthropic, right?
Yeah,
So
that's more
effectively, you might be to pick it out of your CSR budget or additional budget for COVID relief that you basically got from the organization to donate to this.
Yep.
But there was a so initially I also the other part of the question that I was pushing at was that should health and wellness center or the primary care unit be opened up for the private sector as well, given that there is a slow and steady need for modernization at the start of the patient journey, because a lot of the issue today is also how disease is diagnosed and what is the interpretation of that diagnosis by the authority sitting at a PHC for now from a rural perspective. And both of those are big challenges, though there are a number of organizations that are helping build up diagnostic infrastructure or basically getting to the base of trying to interpret the diagnostic test in the right possible way. But there is still scope for some amount of maybe private play in that area, or tech to basically play in that area, where you are easing out the interpretations at the start of the patient journey, so as to make sure that the patient or the rural household is more aware of the repercussions of the disease that they're getting into. So what's the long-term impact of, say, tuberculosis, and whether tuberculosis is being addressed at the first go, or whether it's basically existing for, let's say, 2 years before it's getting completely or fully diagnosed. So that tuberculosis might not be getting into that kind of problem because India has a really strong tuberculosis program. But something like chronic bronchitis, or something like a central nervous system issue, or some kind of cardiology problem, so which can be caught early and diagnosed early, given that you have enough infrastructure to do that and the interpretation to do that. So that, I think, somehow needs the involvement of civic society and private sector. But to Megha's point is that if the private sector comes in here completely, I think it'll be a game of then again incentives and then profit maximization to some extent at the primary level. And that's why I think the government does not want to let go of it, because though giving healthcare is at a point level, on an individual level, is not a public good, but overall health of the society is a public good. So in some cases, the government wants to take the responsibility of making sure that it does not get out of hand, and things don't become absolutely essentially expensive for the basic individual to go and get services, and that therefore the government service has to be provided. But the efficiency of that government service is obviously is very poor, and therefore we are having this conversation. But I was thinking of that line also when you talked about private investment in the area of PHC.
Yeah, so I think Kanish brought out really good point. So one of the main reason is, even though we have public hospitals, those are run very poorly, okay, as of today, and the doctors are overworked in public hospitals. They are not getting paid enough, and obviously the care given to poor people is, it's really shoddy. And if the person has to go to private hospital, that's, they cannot afford it. Whatever their life savings are just going to go in one medical bill. So the issue here is to make medical care affordable for someone from poor economic background. That should help.
One point there, Casey. I mean, this is something that I'm in general observing. So whenever we talk about privatizing something, it could be agriculture, it could be healthcare. have you noticed? I mean, this is something that I've noticed that whenever we think about privatization and the risk from it, we are always imagining privatization to mean that big players are going to come in and they'll basically they'll corner the entire market. But
Yeah.
what I feel is that in actual, I mean, that
It
does
also
happen.
opens up. Yeah.
Majority of the private, I mean, private anything, any market is then actually
Right.
taken over by smaller folks. They don't get a
Yeah.
lot of market share, but then they are the ones that actually either improve the efficiency or the service, or they drive down the costs. But then in
No,
every
true.
discussion, I feel we
Dipankar, I
focus
think
too much on that.
Dipankar, I think it depends on the industry that we are focusing on. Depends on the industry. If we think about telecom, that is controlled by 3 companies right as of now. 3 or 4 companies. Depends on the
Telecom,
company and the industry.
yeah. So telecom or say even
If even if
railways,
airlines and all those, right?
But
so
I
It depends
think
on the
you
company.
the
can't
point
have,
is that
you
it
can't
is
have a
this
small,
there is some sense of inherent Indian protectionism in the way that we think of expanding an industry. We tend to start thinking by the fact that the private sector will ruin it rather than improve it. And I get that point. I think that is where I was thinking of when I started thinking of it. I thought that it's obvious that PHCs or basic healthcare needs a fundamental liberalization of the market, so that it becomes it has already become a commodity service in the cities, where you don't really venture out to go into a government hospital ever, right? If you have access and if you have money. But the issue is that if you don't have that, then start looking around and see what is the cost of diagnostics today. And you will see that the cost of diagnostics is the market rates have moved to such a level that it's untenable for
anyone to,
most of India.
right.
Now the issue is that that price is a factor of effectively what you're ending up, what you're going to pay when you are suffering. And when you are suffering, money sometimes does not become like a concern. You don't have choices, and therefore it is easier for the market price to go up, because like there's always going to be, I think, from a elasticity point of view, the quantity demanded is not going to move. It's inelastic in some ways.
So again,
So
so medical profession mein there is this
inelastic.
inelasticity, as well as there's one thing also, there's this information asymmetry. So if your doctor
Correct.
tells you need this
Exactly.
test, you don't know if you really need it. So
I don't.
those are issues
And it's
are there.
correct.
Agreed.
Correct.
So
And from the fact that it also comes from experience of the fact that there are two ways to look at it. One is that I am a consumer of tests, and therefore I know that while I go to a doctor, now it's almost common knowledge that I will be administered at least 3 tests, and they're going to cost me about 2,500. And it's basic stuff like a blood test,
right.
and you do one another test. If you have a joint pain, you will definitely go for an X-ray or a special thing. So it becomes like a thing that I've already understood that there is 2,500 or 3,000 going to be spent on tests. But the fact is that if I don't have that much capital, right, and that's one hindrance to basically for me to get good healthcare, I might stop going to hospitals altogether if diagnostics is basically becoming untenable. I think that is where this becomes a kind of a challenge for the private sector, for the market to be completely open to the private sector, because we've seen from evidence that the gatekeeping is very high and the prices go up really really high, and therefore affordability for healthcare becomes a challenge, and therefore overall health of the nation can drop
Right.
if you don't have that.
So
From
Casey,
that perspective,
I have a basic question here. Are we thinking of healthcare as a very commodity, like buying? Is it like buying a soap? Is it like say for
no, I
just
think,
coming from this thing? When you are sick, do you just go around the market checking out which is the best hospital with the cheapest cost? Do you go
you
around
don't.
finding that? You
You
don't.
don't.
So are we, when we talk about making the market take over the whole healthcare system, I'm not talking delegating it, making it just a commodity. Are we not doing that?
No, I'll just rephrase na from I mean what my original discussion. I'll Casey, I'll give you an example. I mean I'll take your example only, and I'll tell you what my basic point originally was. So you give an example. So if you have say you have some ailment, and then you know that I'll be asked to get these three tests. These three tests cost me say 3,000 rupees. This is the basic cost that it's going to cost me, and then based on that you make a decision. My question was that why is the doctor taking those three tests? It could be one, that you're legally required that you have to make ask a patient for these three tests, and only then can you prescribe them a medicine. And it's a fair thing. We don't want malpractice. But at the same time, there could be a doctor who's maybe experienced enough who would say, okay, you visit me, and then based on that, maybe he does not require the three tests. He might require just one test or no test or whatever. They have that, and then based on that, they can give you that. They can cure you. So my question there, I don't have any solutions. My question was that because we mandate that this medical profession has to be conducted in a certain way, are we raising the costs? So that was the kind of liberalization I was talking about, wherein I'm not saying I know there's a lot of this, you can't compare like Medicare to soaps, but my question is, because every aspect of medical profession comes under some sort of regulation, might be those regulations are piling up costs at every stage, and that could be one area where we should be looking at so that we make healthcare affordable.
I get that, and I think Ashil, I'll try to understand your point just after this. The thing that I'm going for is that if you open up a market, you have to open up a market, right? Then you can't have separate rules. Today there is no rule for saying that basically you cannot, a doctor can prescribe 15 tests if the doctor thinks that he can do a better job by looking at the results of those 15 tests, right? If you cap it suddenly, then you're actually binding the doctor in some ways, right? Now if we take that example from a doctor's perspective, then you're binding the doctor, so you can't bind a doctor. The second example is that basically, what if a good doctor knows that, understands this environment where you don't, the patient might not have a lot of disposable income to basically go for multiple tests, so I do it without the test to the best of my understanding of the symptoms, and I try to treat the patient. But what is of evidence from a private sector opening up and the private sector basically getting into the business is that clinics and hospitals will try to profit maximize. And when they try to profit maximize, they will try to basically run through high margin products first. Right. So a doctor's visit is actually low margin because a doctor takes a bigger chunk of it, right? But the test infrastructure is cheap in the long term. So effectively, in most of the hospitals, there is almost a quota to do tests. So ultimately, I'm saying is that the doctor might do A, B, C, D, or make A, B, C, D choices. But I know for a fact that the ecosystem in itself forces you to do more tests.
Right. So,
in some way. Right? So I'm saying that what is the proof that won't happen within the rural setup? Maybe the cost is not going to be 3,000, but even the cost of 300 is too much.
It could be. My only argument is that when I advocate opening up, I just want there to be more doctors. There could be a doctor who is profit maximizing. I mean, every doctor would be profit maximizing.
But I'm assuming that when the market opens up, it is not run by individual doctors. So currently, I don't know if you guys.
But why not?
It won't be, because when the market opens up, there will be people looking to make a business out of it.
There will but if you open up the market and do not allow individual doctor to practice, that is not, you are exactly going against the concept of market opening.
You will allow them. You will allow them. But the individual.
So basic regulations should be in place.
The kind of footfall or the volume that a individual doctor can get in a Apollo clinic versus his own clinic.
True.
are
But
different.
but tell me one thing,
So the
Anushka.
economies play like that is what I'm trying to say.
I'll do the ultimate sin of comparing doctors and soaps, but let me give you an example. So there are supermarkets in my say area, okay, and there are small Kiryana shops. So I can buy the same packet of chips, or let me make a let me I have to buy a jar of coffee. I could buy
Yeah,
it from my Kiryana store, or I could buy it from say a Walmart, or I don't know, any fancy
correct.
department
Any
store.
fancy place.
Huh.
Yeah, yeah.
And 90% of the times I currently will go to the department store. I love the ambience, I
Correct.
love shopping around,
Maybe.
all that.
Yes.
But then as
Yeah.
long as there is a Kiryana store, even if he's getting 4 customers and he's just barely surviving, whatever, at least the poor guy who wants to visit a Kiryana store has a Kiryana store. I just want Kiryana stores to exist. I have no issues if departmental stores are getting 90% of the footfall, as long
Yeah.
as the guy who does not cannot afford to go to a departmental store can at least have a Kiryana store. My issue is the way I see it currently, the market is structured in such a way that you either have to be a departmental store by corruption, or because you are government backed, or you cannot exist. So that is my entire framework of thinking about it.
Yeah, but I don't think that my framework is saying that everybody is corrupt. But I'm saying that is that the point about the soap piece is that your the elasticity point about soap is very true, right? But from a healthcare expenditure perspective, I will have to get it, like, if the prices go up and I'm sick, I'll still pay high prices.
But I'd rather pay a high price or a crippling price rather than have no doctor. My issue is I think there are no doctors around. I would rather have a doctor and be in debt for life rather than have no life.
No, but then the assumption is that the assumption then is that basically we can never improve the quality of PHC.
No, no, we.
If you assume that free medicine or free healthcare or highly subsidized healthcare provided by the government today, right? If that turns into absolute crap, then there's obviously you will end up paying crippling prices only if you can afford it. If you can't afford it, then effectively you're out of the bound, right? If you can't afford it, you will die of the disease that it'll fester on and it'll basically ruin you.
Right,
And
which
the
is happening right now.
economy is such that about 60% of today, there's a term called Jhola Chhap doctors. Have you heard of the Jhola Chhap doctors?
Is this
Um,
quacks?
they're called quacks, yes, but quackery is a very bad name given to a lot of people who are trustworthy, actually, because what happens is that
Yeah,
PHC
just
might be complete.
even the homeopathic practitioners are called quacks by the allopathic doctors. If you just check out the Wikipedia page of homeopathy,
Correct.
you get to know who actually created it.
Yeah,
Right.
and the thing is that quackery or quacks are a overall terminology to say that there are bad doctors, right? So effectively, they're not practicing scientific medicine, and therefore your going to them does not guarantee getting rid of the problem that you have.
Right.
But the issue is that if there is a gap, the gap is going to be filled by people because that's a market to be captured. So currently the Jhola Chhap doctors, there are wonderful videos around this from an Indian healthcare ecosystem perspective. That the Jhola Chhap doctors are most trustworthy. Why? Is because they don't have the hassles of being a doctor, right?
Right.
So they are more approachable, and in some ways, bad in a very bad sense. They're also basically in the capacity to in the capacity to prescribe medicine. It got medicine, maybe not really medicine that they've got easily or illegally. They're prescribing medicine, in most cases steroids. And why steroids? Because most of the rural population that basically goes to a doctor needs to get up in the morning and start working tomorrow.
Right.
So दिहाड़ी बचाना है, तो दिहाड़ी बचाने के लिए you have to basically get quickly on your feet, and steroids do that.
Right.
So effectively, even from a wailing child who's basically coming to that dispensary of a Jhola Chhap doctor or a Jhola Chhap compounder, is administered a really strong dose of medication. After which the immediate effect is that basically people regain some kind of energy to get back to work.
Right.
But there's no solution to it, because effectively it comes back. You're not solving the problem, you're just troubleshooting. So that is the ecosystem that they exist in. Now imagine that ecosystem basically opening up to a private sector, which is even more expensive than what the Jhola Chap is actually very cheap. You pay 15 rupees, 20 rupees, and get the medicine and the attention that you need, right? And you move on. But if you have to basically diagnose a problem for 200 rupees and then get it to a place where the medication itself will cost you 500 rupees, immediately it's a no-brainer that you won't use it. Right? So I'm not advocating that it shouldn't come in. I'm just articulating that for me is the bigger problem, wherein there's a economics. The economics of healthcare pricing does not work for a majority of India, and when it doesn't, then the market is actually opened up to multiple private sector players who are existing as of today, who but are not legalized private sector players. Therefore, this I don't know in 2017 you guys remember or not, 2017-18, while Ayushman Bharat was getting launched, they actually noted a point about giving a lot of these co-ops, so-called co-ops, or practicing
the 2-year bridge course.
To a 2-year course to get licensed.
Right.
Because if they get licensed, suddenly your capacity of healthcare increases overnight.
Right.
Right. And if you're able to basically increase it overnight, look at the impact that you are able to drive in the rural sector. From a numbers perspective, that suddenly you did not have capacity, now you have extreme amount of capacity, almost out of thin air. But that capacity already existed. It's just that basically you're now accepting of the fact that they exist and they're practicing medication whether you like it or not.
Right.
So that I think steps like that, but in a smarter way, can actually improve the private sector if it's done in a regularized way, where the 2-year course is really stringent. The 2-year course is really hard on the fact that you can practice medication, medicines. But going by whatever has happened in the past, I think we're not there. The capacity has not been built out to actually liberalize and get those 2%, those 25%, 30% extra capacity, legally practicing medicine. So that capacity has not been built up. Maybe the private push has to be first build up that capacity, get more people in the mix, and then let them practice. But the opening of a big players might lead to maybe a choice, as in you can still open this up and keep the fact that an Apollo might want to go to 500 more districts in India and open up smaller clinics. Fair enough, as in they can actually go out and invest in that if they see an ROI there, but not do away with the PHC, because the PHC will still remain.
At no point did I say that government should get out of.
Not what you're saying. I'm just like I'm thinking aloud right now, so I'm going in different directions. So I'm just caveating my point in some ways. So, but yeah, that from that perspective, I think the economics of pure private sector, the way that we see it, is very difficult for me to understand how it will work in a rural setup, because the appetite is not there in my head, as in the way that I see it.
Sure.
ये सब मैंने बकवास तो कर दी, मेरे को मालूम नहीं था कि तुम लोग पहले क्या बात कर रहे थे उससे पहले.
नहीं, आइडिया एक्चुअली इसी पे था. We were discussing about so Pranay has sent that question. So we were just discussing what could be the different solutions. I mean, why do we have it started with why do our students go outside to study medicine, and from there we went on, okay, doctors are not paid enough, doctors ka shortage hai. Then we went, okay, there's a college ka shortage. From there we went to hospitals ka shortage. From hospitals ka shortage we went to there is not care enough or it's unaffordable, and that's where you stepped in, and from there we went on.
I'll just share a story share करता हूँ. There's a story of this foreigner, right, who comes to India. He stays in India for a day. When he goes back, he's ready to write a book about India. Another foreigner reading his book, comes to India, stays there for a month in India, and that person is able to write a chapter of the book. Another person, third person comes, he stays in India for some few years. He's able to write about one page of the chapter. So the idea is the person who stays in India for like a decade or so, he's not able to write a paragraph also. And you give the idea, ask an Indian to write about India, he'll not be able to finish a sentence. That is what actually happened to me when I started this conversation. I had a fair idea where I will be looking into. As of after the discussion, I am not able to write a single sentence. A lot of perspective I got so many perspectives.
All of us are in the same boat. All of us are basically people who stayed in India for 40 years. At least I stayed in India for 40 years. So there's no, all of this learning and understanding. When it comes to writing a single page, I don't know. That's why I'm so impressed with Dipankar of how he manages to keep writing all of these things. Because the minute I put my pen to paper, figuratively, not literally, but I think, what will I write? As in, I'm not even sure what I'll write is right or not. As in, I'll be absolutely wrong. Maybe my understanding of the situation needs more time, more reading, and then I basically just I block myself. I don't write.
But I have realized after going to Ganesh's sessions, I have understood how to structure my thought processes. This structure is helping me out because before I got into this public policy thing, I had a very basic and generalized and holistic approach. I was not able to break up things. Right?
Correct.
As of now, it is helping me out. I think that is going to help me out later on in the course after finishing this course. Initially, I didn't have these ideas, like what is all these structures, what is the market structure, all this breaking up. I think that is going to help us. That's a positive I'm getting out of it.
After Ganesh's class, I think we can schedule classes with Dipankar.
I have nothing to teach Kanishka. I've already Ganesh's class was the second writing class that I've kind of
this is
joined.
what I call a white lie.
I think we are going to penalize all the people who left the class without saying Dipankar Baba ki jai.
Dipankar Baba ki jai.
अच्छा अभी खत्म कर रहा हूँ. मैं लेट आया नहीं तो.
By the way, do you guys want to go through that LU04 या आप लोग ने पढ़ लिया है?
अरे एक बार बोल दो यार, बोलो. आया तो इतना देर रुके तो आप बोल ही दो.
नहीं.
Summarize it in 5 sentences.
Yes. Please, I'm all ears.
Okay, why I'm thinking so is I'm thinking we had a good discussion. हाँ, I've recorded it. हाँ, so I'm planning कि इसको YouTube पे डाल देते हैं, मतलब personal इसमें मतलब private करके ही whoever missed it they can get it from there because इसको upload करने जाएंगे.
Private क्यों करेंगे भाई? तुम पैसा कमाओ उससे.
I was about to say the same thing.
हाँ.
You guys don't realize मुझे हद ज़्यादा मतलब ऐसा anxiety रहता है. मैं नहीं I don't know. हाँ.
हाँ नहीं डालेंगे.
नहीं I'm okay. नहीं डाल सकते हैं.
ऐसा सोच के कि नहीं जा रहा ये, मगर हम फिर डाल देंगे. मेरे चैनल पे डालेंगे ताकि पैसा मुझे आए.
चलेगा.
I was thinking about something, right? Probably after some time when we get more knowledge about this thing, we should start our own podcast. Right?
Or will all be क्या कहते हैं guest on Kanishka's podcast.
Yeah. Or probably we can have our own podcast, have Kanishka come in as guest and tell us his.
Yeah, just for me to know, इन्होंने बोला था कि after every some time there'll be some break kind of thing. When is the break coming up? You have been there.
I checked it. It is sometime in end of April. I thought it was in March.
Term 1 है ना. So the GCCP that I did was full first term. Not exactly, but around there. तो उतना टाइम लगेगा फर्स्ट टर्म खत्म होने में. फिर 2 महीने बाद थोड़ा सा ब्रेक है. उसके बाद सेकंड टर्म स्टार्ट.
नहीं अभी यहाँ पे जो PGP का स्टूडेंट हैंडबुक दिया था उसमें लिखा था कि our first session term is from 15 Jan to 30th April. फिर 20th May से सेकंड टर्म शुरू हो रहा है. Again 27 अगस्त तक. फिर सितंबर is off. 1st October से थर्ड टर्म शुरू हो रहा है.
That तो फोर्थ टर्म जो है लास्ट टर्म.
फोर्थ भी है क्या? तो
3 only.
हाँ.
3 है नहीं. एक तो मतलब थर्ड जो भी लास्ट वाला है उसमें तो बेसिकली so it's going to be completely on us. Like we'll have maybe a mentor or something, and then we'll start working on our topic, whatever we choose. But sorry, we blocked it.
Yeah, please, sir. Yeah, okay.
Hanji, let's go ahead for LU04, please.
Acha, yeah, just a second. I'm sharing my screen. Just let me know when it's visible.
Sure.
अरे कहाँ चला गया?
Not yet. Okay, now it is.
So basically these were broadly the topics that were covered in LU04. There was price ceiling and how it results in shortage, rent control, price floors, consumer surplus, producer surplus, impact of taxes, tariffs and quotas, free goods, and in the end they go into a specialized rant about rent control. So for price ceiling, I just dipped into my notes. I L04 का notes बनाया था मैंने luckily. So basically
यार ये image कैसे paste करते हैं? Sorry यार.
हाँ.
Obsidian में I tried to basically paste an image, it never happened.
नहीं, you can paste an image ना. So for example अभी मैं इसका
तो सीधा screenshot लेके डाल दो बस.
हाँ.
नहीं कनिष्का वो नहीं होगा ना, तुम दीपांकर नहीं हो.
अरे हाँ, so it is there. हाँ, इसका तो हाँ, it's just there.
कई बार मैं भूल जाता हूँ ये सब बात. Thanks.
Okay, back to the topic.
मैं दीपांकर को भेज दूंगा जितने भी इमेज मुझे पेस्ट करने हैं मेरे ही वाले नोट्स.
Good boy.
नहीं, but to be honest कनिष्का हाँ इसमें
भेजोगे कि बेचोगे?
भेजूंगा मेरे को तो खरीदना पड़ेगा भाई.
नहीं, I'll look at, मेरे को याद नहीं है मैंने कैसे किया था, बट हाँ इसमें थोड़ा कॉम्प्लिकेशन था. आप ये कह रहे हो, I found something else. I found how to put in ये drawings into it. तो मैं तो इसके साथ खेलता रहता हूँ ऑब्सिडियन के साथ.
आशुल तुम इन दोनों की बात में सुनना, ट्रस्ट मी, हम दोनों को हम सबको बेच देंगे, ट्रस्ट मी. दोनों के दोनों.
वो था मार्केट ओरिएंटेड ना.
I know. Okay.
Acha. So basically price ceiling is when we have a certain price cap on something, so you can't charge more than this, so which is generally in case of a shortage. So for example, if we look at this image, the price is at the point P and the price ceiling is set at P star. So here basically what is happening, at this price P, the supply would be only quantity Q1 whereas demand was quantity Q2, but by implementing this price ceiling, government pushes this down. But then what would end up happening, because in the end supply is limited, who would end up so the questions that come in here are how would the rationing happen? So who is supposed to get the goods that because in the end only this much goods will be supplied, or maybe a little beyond this, but definitely not this much. So one would be that there is first come first serve, which again violates the rule that people who need it more may not get it. And the second is discretion by an authority. Yeah, I think Anupam had already covered in his lecture. So if you guys don't have any doubts, I can move ahead.
Yeah.
ठीक है. Rent control I'll come back in the end because it's a form of price control only. Then there is price floor. Price floor when there is excess supply and suppliers want more price for them. So for example, at this point suppliers at price P are willing to supply Q2, but the buyers are only buying Q1 quantity. So in this case you ask for price floor. So recently there was this case Assam mein, I think it was the Assam or Darjeeling mein. So these tea sellers were saying that we are producing a lot of tea and 50% of it has to be sold on or below the market price. So there should be a price floor. Because we are producing so much ki we are not able to sell it at a profit. But then the question remains that if you implement this price floor, maybe people will not buy as much. So maybe the problem is not that the problem essentially is that you are producing too much and you should not be producing as much as is being produced. So as in the supply has to be reduced. But for short term, sometimes governments implement this price floor so that you have to pay this minimum amount. After that, there is consumer and producer surplus. Consumer surplus is the difference between maximum amount that a consumer is willing to pay versus the amount consumer actually pays. So I have a diagram in this. So for example, this is the diagram, and consumer surplus is the area below demand curve. So another way of thinking it is कि at price at I mean a cost of $20, the consumers are willing to I mean the willing to buy any amount of quantity for price for $20. But since the price is at $80, नहीं यार इस पे मैं कंफ्यूज हो जाता हूँ, just a second.
एक मिनट repeat.
हाँ. So my point was the price. This is the demand curve, right? And say the price is at $80. So on at $20, if we look at this graph, so at $20, the this क्या कहते हैं?
This is the demand that 90.
This is the demand graph, and consumers are willing to buy.
90 is a quantity, right? Quantity sold at price 20.
Sorry. Now I got it. So say the price is at $20, not at 80. So a consumer is willing to even buy something for $80. But since the market, I mean, the price is at $20, they get all this quantity, which they were willing to say at this point, the consumers were willing to buy, say, 40 units. But since the price is at $20, they get to buy it at $20. So all this area becomes their surplus. So this is the extra amount that they were willing to pay, but did not have to pay because the prices were lower than this. Similarly, for this producer surplus, that is the minimum amount they are willing to accept. But agar market price is higher than that, that is the additional benefit that they get. So for $20, this producer was willing to sell 20 units. But since the price is at $40, he gets to sell those same 20 units, which he was willing to sell for 20, to sell at 40. So that is the producer surplus. Okay, coming down, then there is the impact of taxes.
एक सेकंड, वो जो प्राइस सीलिंग और प्राइस फ्लोर बताया था, इसके कुछ एग्जांपल्स भी बता दो यार.
Okay, price floor का तो price ceiling का the biggest example is rent control that I'm saving for the. चलो ठीक है, वो अभी डिस्कस कर लेते हैं. Price ceiling is when you don't allow the prices to rise beyond a point. So for example, in a number of cities there is rent control, wherein the rent is higher than what people want to pay. So then we implement price ceiling. So there is this one second, I like this. ये इस पे था जो economics in one lesson है. It had a chapter on rent control. So it says rent controls are put in place when it's felt that there is a sudden enormous demand on the properties, say due to troops landing in a city or houses destroyed, and the rent rises dramatically. Rents are frozen and tenants are said to be rescued. But this is a grave injustice to the landlord, who can now not charge the rate he deserves. This often leads to landlord not maintaining the property due to diminished returns. अगर उसको जितना market में cost लग रहा है, he is not able to recoup that, so then it's his loss. So one way to looking at that would be कि अगर एक city में अचानक population has doubled, so cost of everything has risen, not just rents. But if we now say you can't charge rent more than that, so the landlord's budget or his profit is disturbed. And once that happens, he does not have any incentive to improve. But let's say he wants to improve his property, but since he does not earn any money, I mean as much money as is needed, he will not be able to upkeep the properties, which results in mostly in the cities where there is rent control. There is this problem of the infrastructure decaying. So just say I think New York is a famous example. Mumbai is my favorite example.
Mumbai is a big example where rent control, a lot of the existing capacity has completely is completely going to the dogs. It's falling, crumbling down because nobody wants to repair houses that are in prime locations, but you only end up earning some 500 rupees, 600 rupees, maybe lesser on rent, which could have actually gone up to a lakh by now if the market had been operating in its regular way.
Exactly. मतलब I went to Mumbai a couple of times and I always found it depressing because वहाँ पे हर building it's like mold everywhere. It's So there are a couple of things there. So one more thing that has been observed a lot of time is कि when you implement rent control, what you're doing is you're incentivizing or you're benefiting the existing people who existingly have those houses, and the people who can now get the house, maybe even if they are willing to pay higher rents, they are not getting the housing. So rent control in a way is discriminatory. Another thing is that in a lot of places, rent controls, when implemented over a long period of time, the landlords tend to be poorer than the tenants, because tenants are increasing their, I mean, they are benefiting from the boom in the economy, or however their incomes are rising, but their rent is not rising, which leads to a lot of cases where your tenant is richer than the landlord, but then they'll vote for rent control to stay in place. इनफैक्ट मैं तो ये इमेज दिखाने वाला था कि सो फ्रेंड्स में या इवन अ लॉट ऑफ सिटकॉम्स विच आर अराउंड बेस्ड अराउंड न्यूयॉर्क ना, सो देर इज दिस कॉन्स्टेंट स्ट्रगल दैट दे वांट टू कीप देयर हाउस, एंड एज अ रिजल्ट जो बिल्डिंग का सुपरवाइजर होता है, दैट गाय बिकम्स वेरी इंपॉर्टेंट बिकॉज ही इज द वन हु डिसाइड्स इफ यू गेट टू स्टे और नॉट, which brings us back to the point of discretion by an authority. So इस केस में Joey had to dance with this guy because
with the
rent control. Yeah.
Isn't that the naked guy?
नहीं,
No, that's not.
but हाँ, while I was googling it was कि they never show the ugly naked guy, but
Ugly naked guy.
yeah. If anyone of you like you've seen Seinfeld, तो उसमें there's one episode where George starts to make मतलब the house will be given to the guy with most tragic stories. So then he starts bringing up the story of how his wife is killed and all that. So वैसा craziness happens. For price floors, Mukhta, the example was the tea sellers in Assam. This is a recent story. I think last month I read this, that we are producing a lot of tea which is not getting, there's not enough demand for it. So 50% of it they are able to sell at a decent margin, maybe they export it or sell it locally. But 40 to 50% of the tea is being sold below the price of manufacturing it. So they want prices to be risen to a point जहाँ पे at least उनका the cost of making that tea, growing those tea leaves has to be recouped. But then point is कि if you can't, I mean from a market perspective, if you can't justify your costs, maybe you should not be producing that. But then the counterpoint is that if we go by that rule and somehow we eliminate our tea gardens and tomorrow there's a need. So how do we balance that? So there is some nuance in there, but broadly ये idea रहता है price floors का.
Okay, thanks.
Impact of taxes is that this price of point of equilibrium is pushed. So अब इस price floor की जगह if we imagine say a tax. So if I am willing to buy something for 100 and the seller is willing to sell this product to me for 100 rupees and government आके उस पे 18% GST लगाए, so then that point just pushes upward. But then the point is, if the equilibrium is now pushed at this point, who gains from this shaded region? And that shaded region actually goes to the government. So they push the price up, seller does not benefit, buyer does not benefit, government benefits. But then another point there is, okay, who will burden this, who will take the burden of this extra amount? Will it be the seller or will it be the producer? Consumer. The idea
So
there,
one example of that is that I just wanted to talk about an example. Finish the point, Dipankar, then I'll...
yeah, sure. So there the idea is how will that be distributed, and one of the ways of looking at that is the demand elasticity. If the demand is elastic, then producers will take the entire burden on them so that consumers don't flee. Whereas if the demand is inelastic and producers are sure that these consumers are not going to, I mean, they have to depend on this. So if there is a price rise due to taxes or due to tariff, they'll shift the entire burden on the consumers. So actually there is some mathematical formula ki based on how elastic a good is, you can decide which party will have to bear the brunt of your taxes. Yeah, Casey, you were saying.
Is that there was no that sorry, I've forgotten a few names. No, I was talking about this one thing that was part of our pre-read, which was again that same point about skipping China's journey and becoming reliant on services and largely outsourced services. So Mukhta, you seem to have read it, Dipankar. Mukhta, Arshil, have you read that?
I have not read it, Casey.
I haven't.
Yeah, briefly I read the one.
So it's the same. It's I think written by Raghuram Rajan and another person, Oli or somebody.
Lamba something.
Lamba, yeah, Rohan Lamba or something. So anyways, the point is that there is a unemployment issue, right, in India, and there is also basically a growth issue. Now, the tailwinds of our 1991 liberalization have kind of died down, right? So we have to find new levers of growth and explosive growth for the next 10 years so that we can actually compete with the larger countries in terms of growth, and also keep alive the idea that India is growing at the rate it has to, rather than flattening out right now, which is happening in some ways, because there is no new growth that's happening. It's all a factor of the old growth that we've seen. Now, when you plan new growths, one of those aspects that India is focusing on is, capital expenditure, capital intensive industry is getting, like this budget basically had an increase of 35% in the kind of capital outlays, expenditure outlays, which means that we are trying to bolster the middle layer, manufacturing layer. And when we bolster the manufacturing layer, then it goes up to give you more jobs in the manufacturing sector, by which a lot of the agri population, a lot of the population that is not skilled today or is very of low skill capacity, can move to slightly higher skilled roles in the manufacturing sector, and therefore get a job and a better livelihood than what they're earning. That's the fundamental way of thinking. Now, PLI's production linked incentives are also a part of that overall ecosystem. What this paper argues is that, look at the current example of laws within India from a manufacturing perspective, and then try to see if that's a possibility. Now, the paper says, or the article says, that multiple times the government, shifts between two positions and is very quick to get in, tariffs which are lobbied by certain groups within India to make certain things which are input material very expensive. And when that becomes expensive, then effectively the whatever subsidy that a manufacturing unit tries to earn through production actually gets wiped off, because they're paying a higher cost of the input material. So one of those examples that they wanted to take was telecom industry, where they said that the telecom industry, they just said it in one line, that the input tariffs on telecom industry, or not telecom industry, sorry, mobile manufacturing or mobile telephony manufacturing, the input cost is, the government has put tariffs there, which is offsetting the PLI subsidy or the incentives that the industry gets. So in some ways, net, the industry really did not gain anything, because you brought in an input cost which does not say anything or help the industry in any way. Yeah, this is the piece. So yeah, just this paragraph, stay there. India tried to do this before and failed for straightforward reasons. A tariff on inputs is a tax on exports. Indeed, a recent study of mobile phone manufacturing in India suggests that the production cost increase from tariffs on inputs completely offset any subsidies, reducing the effectiveness of the PLI scheme in encouraging exports. So effectively, this is one example. But the broader example is saying that we always do this flip flop. And when we do a lot of flip flop for international, players, setting up manufacturing units in India always becomes questionable. And when it becomes questionable, even though you put in PLIs, people don't want to take in international investment and do more manufacturing in India, because they are not sure whether tomorrow some internal industry will lobby and there'll be a tariff on an input cost, and therefore all my psychological or real marginal revenue that I want to get over my marginal cost will automatically disappear overnight. So in that lack of clarity and transparency, your manufacturing push might not yield the kind of jobs that you're looking at. Secondly, the point that they try to make is that you have always uh, manufacturing, uh, high manufacturing countries, or basically countries that have deep expertise in manufacturing, always try to gatekeep new players in this environment. So they trying to basically undercut you on price, undercut you and everything, so that that it becomes extremely competitive. So winning in that competitive environment becomes very difficult for you to do. and it's not something that you are building on your strength currently. You're building a new strength rather than anything else. The second point is, a lot of the new countries that are consuming manufacturing produce don't want to create another country in the world which can dictate terms like China is doing from a manufacturing perspective. For example, the semiconductor issue. Now, if China was not the only manufacturer in the semiconductor world, in the world might not have been basically facing the kind of challenges that they are facing. So they want to decentralize in some ways the overall manufacturing industry. So there are a lot of roadblocks there, and therefore you don't want to basically go out completely on the manufacturing way. You want to also focus on the services way. It comes with its own challenges, fair enough, that it's very difficult for you to basically upskill 300 million people in a country to catch on to outsourced services, which are very highly knowledge centric. And when you don't even have basic infrastructure and basic education, how do you actually, dream of outsourcing services at scale? It's a very improbable dream, but that's the conversation in this. I just wanted to bring that up to the point of the PLI and the tariff conversation that we were going through, in the spirit of which I summed up what the article is saying also.
Thank you, Casey.
Yeah, thanks, Casey.
So that is one example of the tariffs going wrong, where the tariffs is basically the input tariffs is just to make sure that you're not consuming from outside and your industry is also growing. Raw material industries, input cost industries.
Right. So in the same way, so basically they are, that's why they have, in here, they have bunched together tariffs and quotas and saying that firstly, tariffs are practically like taxes, because if you implement tariff on something, you're basically saying we'll increase the price by certain percentage points, which is like a tax only. And similarly, what quotas is that you can only import a certain quantity of a certain goods. And when you do that, it also has the similar effect. Quotas and tariffs achieve the same thing, because you limit the amount that people can buy, and as a result, they have to pay a higher price for it. And quotas also have this issue because tariffs you can control, everything else you can control. But if you say
Is this your beep sound? Did you say
Actually,
something
that's
wrong?
Are you jumping around?
He's self-censored.
No, this is actually an alert for my sister's message so that I don't miss it.
Oh,
That's a nice, very interesting. Is that a Apple exclusive?
No, not at all.
That sound.
No. Okay, sorry.
Yeah, not an issue. So what I think, so basically
Deepankar, please beep this out, cut this out, edit this out in the YouTube video, okay? We don't want people to basically
I
laugh
have
in the
no
middle
idea
of
how
your-
to edit videos, Casey. I'm just going to upload. That's why I'm saying let's keep it
Any
private.
which ways, you will catch on to it in one day. By the end of the day, you will be basically putting it.
So reminds me of that वो हिंदी का मुहावरा है ना, चने के झाड़ पे मैं चढ़ चुका हूँ ऑलरेडी. मैं खुश हो आपके सामने आई एम बीइंग मॉडेस्ट, अकेले में मैं खुश हो जाता हूँ.
काटेंगे नहीं चने.
हाँ. So basically quotas के साथ there is one issue when you use quotas or tariffs. So maybe you don't want to be seen as imposing tariffs, so then in that case countries impose quotas. But problem there is that if you limit the quantity, then you don't know how the foreign producers are going to respond. So for example, if you say foreign producers can only we'll only import 50 units of certain goods, the foreign producer may think, yeah, it's not worth for me to invest just export just 50 units, let me not export anything. So that is one caveat that we have to think about when whenever we implement the quotas. And also when you this is the amount that you increase by quota, this is the loss that society faces. So like we said ki anything above this is the what do you call it, consumer surplus. So when we are increasing the price from this level to this level, this consumer surplus is getting lost.
Yeah.
Finally, free goods. Also, rent control. There was one caveat. Rent controls are actually, these can be of two kinds. The one we discussed was hard rent control, where you don't let people raise rents beyond a certain point. But then there is another form of it which is called soft rent control, wherein you want people to invest into new properties. So there, what you do is you say the rent control is on all the properties that exist right now. But if anyone is building any new apartments, those are exempt. So in a way, you are incentivizing people to build new apartments, and also you let them increase the rents with the rise in inflation. But one unintended consequence I was thinking about this is, if you do something like this, then there is an incentive for the landlord to be the evil guy, to just throw people into the, I mean, do make people leave the building so that he can tear it down and build a new building. So in a way, you're achieving the same objective. You wanted the building to be modernized, but in this way, because the tenant cannot, I'm sorry, the landlord cannot legally ask his tenants to move out. So there are a number of these horror stories from US. I was बीच में video देख रहा था. So wherein they poison the air, they block the water, so that basically they torment their tenants, so that tenants would leave in order to tear it down and build a new building. So in a way, rent control eventually then fails again. So it was better, at least, if you could let the landlord legally raise the rent or get new tenants. And the other issue is, one case where rent control absolutely works is when it's a monopoly. So if someone has a monopoly over housing, then if you implement rent control, they can reduce prices because they have been basically abusing their power as their market power. And their rent control will help, because once they stop earning as much as they can from the units that they currently have, then the developer or the builder will try to build more so as to maximize their profit. So only in case of monopoly does rent control actually work in the way that we want it to work. I think that finally, free goods. So basically, free goods is a note about cross subsidies. So free goods is very expensive because there are a lot of marginal costs, and the demand is near infinite, because if you offer something for free, everyone will demand it. But in digital age, some goods can be given for zero cost. For example, Amazon does not, for producing one extra ebook, Amazon does not have to make any additional investments. That's why they can give away free goods, which I just realized is what Kindle Unlimited or Prime Reading is. So they give you free stuff so that you buy the Prime membership. Similarly, the other a similar thing is cross subsidies, where you sell one item at loss so that you can sell the other item. So the example that they gave is that Gillette sells razors at a very low price, but then they make that money from the sale of blades. And similarly, Monty Python, the comedy group, what they did was they put their videos on YouTube, which was for free. But then because people liked their comedy, they got used to it. Then that sparked the sale for their DVDs. So once you are in a digital environment, a digital market, then that zero pricing strategy could be beneficial to the dominant player, but then marginal player may not benefit from it.
Mukhta does it by selling, broken wires that break in 2 months, and because if you buy an Apple phone, then those wires are the only wires that work.
There's a joke in a cycling community here. There's a joke in a cycling community here that if Apple starts manufacturing cycles, they will sell the seats separately.
Seats separately.
That's true, Pata. That's true actually. The other day, there's this cousin of mine who called me and she was like, Mukta, ek baat karni thi. I said, tell me. And she's like, we've just bought this phone and, for my son. And, she said, it's 56,000 ka phone hai and they haven't given us the charger adapter. So I said, why don't you send me the content jo uska hoga piche phone ke piche aap picture bhejo. So when she sent me the picture, and I was like, मैं कहा इसमें सिर्फ phone और wire ही है. So she was like, what do you mean wire ही है? तुम इसको charge कैसे करेंगे? मैं कहा वो आपको charge खरीदना पड़ेगा. And she kept saying the same thing. But ये 56,000 का phone है यार. But ये 56,000 का phone है.
There was a time जब phone के साथ you got headphones and good quality headphones.
Yes.
आज तो we don't even have that expectation anymore.
Up to Apple. With OnePlus, you get not only everything, you basically, I think with OnePlus is now giving those AirPods also. some of the phones.
ऐसा क्या? I never got it.
And they give to top it all, they give you 2 of those covers as well.
No, just one.
Actually, OnePlus, if you see, na, it's as good as an iPhone. It is actually iPhone. OnePlus is very good. I think the quality of their camera and everything, all the functions also for that matter, I think they are par with iPhone. But just that just having an Apple phone is like
yeah, exactly.
Let me pause the recording.